Go ahead.
Come in here.
Hey, how are you?
I'm fine. How are you?
Good. My name's Jordan. I'm going to be your respiratory therapist today.
Okay.
If I could please verify your name and your birthday.
Kimberly L. Jahan. Date of birth is 7/16/84.
All right. Looks like the doctor has ordered you to get on a meter dose inhaler and with albuterol since you have been having some wheezing with your asthma.
Yes.
All right. We're also going to do a peak flow meter, and I'll show you how to do both of those after I go wash my hands and put some gloves on.
Okay.
All right. If I can get these on, we'll begin.
It's okay.
Okay. First off, we're going to start off by taking some vital signs.
Okay.
You're just going to listen to your chest.
Okay.
Every time you feel my stethoscope, just take a deep breath in.
Okay.
If you could lift up your arm, please. Good job. I'm just going to do your back.
Okay.
All right. There is a little wheezing going on, but that's why he's putting me on the inhaler.
Okay.
And I'm just going to write that down real fast. All right. I'm going to check your heart rate. Do you mind if I touch your hand?
No, it's fine.
I'm going to put it right beside your stomach. All right. Your heart rate was good. It was about 85, which is normal, and your respiratory rate was about 17, which is also normal.
Okay.
All right. So this right here is a peak flow. Have you ever used it before?
Yes, I have.
Okay. Well, we're going to do three different attempts, and the highest one is going to be what you want to shoot for.
Okay.
So if you can just put your mouth around the white thing and blow out as hard as you can. All right, good job. Looks like. All right, we're gonna wait a few minutes, then we'll do another attempt.
Okay.
All right, looks like it's been a few minutes.
Am I improving?
It was about the same, but that's okay.
Okay.
We'll wait a few more minutes and we'll try another one.
Okay.
All right. That one was really good.
Great.
That one was about 400. Okay, and over here we're going to write your green, yellow, and red zones.
Okay.
And you pretty much, I'll show you, do the highest attempt and times that by 80, or 0.8.
Okay.
And then you take the next number and do that by 0.5. So I'll write those here for you. You want to always stay in the green zone. If
Okay.
you get in the yellow zone, that's when you're going to want to use your inhaler. And if you get in the red zone, you're going to want to call the ER because you're probably about to have an asthma attack if you're not already.
Okay.
So you're going to want to do this once in the morning and once at night. It's going to help you. It's going to help prevent asthma attacks because if you know you're getting in the yellow or red zone, you're going to know you're about to have an asthma attack and you can prevent it by doing that.
Okay.
Okay, so next we do have your inhaler. All right, have you used this before?
No.
Okay. Well, if you take it out, it shows you it has about 200 different puffs in it.
Okay.
Okay, so every time you do a puff, you're going to want to kind of document it so that you know how many you have left.
Great.
Okay, so you're going to want to warm it up. Just do this so it helps get into your airways better.
Okay.
And once it's warm, put it in here. And then anytime you haven't used it within 24 hours, you're going to want to spray it the opposite way to kind of get rid of the dust particles and stuff that are in there.
Mm-hmm.
1 second, sorry. Okay. So pretty much you're going to want to like keep it about 3 fingers from your mouth.
Okay.
And you're, yes.
Okay.
And like you'll put it right at the end of that
Mm-hmm.
and you'll slowly breathe in while you puff it.
Okay.
And after you breathe in, you're going to want to hold it for about 4 to 10 seconds.
Okay. Make sure I got it right.
All right. That was a good attempt.
Okay.
Okay, so you're going to want to use this, like I said, anytime you're in the yellow zone or you feel like you're about to have an attack or anything. And let me write that down. anytime you have to do 2 puffs, you're gonna wanna wait a couple minutes in between puffs so you can kind of get back to normal.
Okay.
Okay, and then also an easier way is you can use a spacer. It's pretty much instead of doing the 3 finger, you just open this up, you put it in the end, and then you'll put this in your mouth, and so it's kind of like putting the space in between there for you.
Oh, okay. This seems easier. Okay.
And after you do it for a couple days, you're probably gonna need to clean this out because residue is gonna get on the sides.
Mhm.
So you're gonna wanna do 1 portion vinegar and a portion of water, and then just wash it and then let it air dry, and then it'll be ready to use again.
Okay.
Okay, so you wanna try this one?
I can.
Hold for about 4 or 6 seconds. All right, good job. I'm gonna go ahead and check your vital signs again. Listen to your heart rate. You can breathe in. Deep breath. Good job, and I'm gonna do the front. All right, it does sound a little bit, I don't have to do that this time.
Okay.
But it does sound a little bit better. There's not as much wheezing going on. I'm gonna do your or your pulse, sorry.
Okay.
All right, heart rate and respiratory rate are still in the normal zone. All right, is there any other questions you have before I leave about the inhaler or the peak flow or anything?
No, ma'am.
All right, well, I hope your asthma doesn't affect you as much with those 2 devices, and if you have any questions, you just let me know.
Okay. Thank you.
You're welcome.